Hello, this is the part 2 of hematology lecture series in special topics 2. And our outline for today is as follows. The general overview of the RBC pathology with signs and symptoms, the classification of anemia, di-divide natin yan according to the mechanism of disorder. So let's start with the general overview. Unahin natin the patient history and findings, the usual expected physical examination, and yung clinical signs and symptoms ng mga patient suffering from anemia. So first, easy fatigability, madaling mapagod. Bakit kaya? Because oxygen, which is primarily carried by your hemoglobin, is the major component of ATP, which is yung energy natin, source of energy natin. So, pag mababa ang oxygen, mababa ang energy, ang patient madalas nagsasuffer with fatigability. Second, shortness of breath. Madalas silang nagkakaroon ng palpitation, yung mga yan, and nagko-compensate kumbaga yung katawan due to decreased oxygen level. So, naghahabol ng hininga. Parang hinahabol or kinokorek ng katawan ninyo yung decreased amount of oxygen at the tissue level. And kapag magbe-base tayo dun sa demographics of the patient. Sa mga bata, madalas ang anemia is caused by parasitism, specifically your hookworm infection. Kasi sa hookworm infection, mas malaki yung nalulus nating dugo. And kapag you further ask the mother or the caretakers, baka meron silang presentation such as yung pika, which is an unusual eating habit ng mga bata na lalo na sa mga cases of IDA or iron deficiency anemia. I-discuss natin yan later on. And then, while in adult females, ano ang major cause of anemia? During menstrual period, lalo na pang madaming menstrual flow. Paano masasabi kung madami ang menstrual flow? If the patient uses more than 8 pads per day, and madalas kapag sa gabi natatagusan talaga, kahit may pads, buong kama, minsan may buong kama, may may bleeding, may dugo. Then lastly, yung adult males natin, lalo na sa mga 60 and above, 50 and above, yung mga yan, madalas kasi sa kanila, may mga history of colon cancer. Kaya, isa sa mga ini-investigate natin, lalo na kung chronic case of anemia, lalo na sa mga adult males, you have to investigate further for colon cancer. Okay, definition naman tayo ng anemia. So we have the functional definition and operational definition. Based on research, di ba? Iba ang functional and operational. Sa operational, paano mo i-measure yung anemia? Okay? Pero generally, anemia is a condition wherein your oxygen levels are decreased. Okay? Paano i-measure? By measuring RBC counts, hemoglobin, and hematocrit determination. Kailangan yung tatlong yan bagsak in order to classify the condition as anemia. For the mechanisms of anemia, we have problems regarding erythropoiesis, and second, blood loss and hemolysis. Discuss natin yan later on pagdating sa mga classification of anemia. Pero in overview, as an overview, ano yung mga problems regarding sa erythropoiesis? Una, ineffective erythropoiesis. May ongoing RBC production, pero yung naproproduce na cells are defective. Okay? Ano yung mga conditions na pwede natin ma-appreciate yung ineffective erythropoiesis? So first, megaloblastic anemia. Yung mga cells, hindi sinusundan yung tamang RBC maturation, kaya naiiwan sila as large size. Kaya tinawag natin silang megaloblastic anemia. Problems with globin chains, yung ating thalassemia, and in cases of porphyria and lead poisoning sa sideroblastic anemia. Insufficient erythropoiesis naman, mababa ang levels ng mga RBCs. Maybe due to number 1, may problem ka sa bone marrow mo mismo or sa erythropoietin. Okay? Ano yung mga pwede mong i-identify as insufficient erythropoiesis? Number 1 ay DA, iron deficiency anemia, anemia of chronic inflammation or ACI, yung ating mga problems with bone marrow leukemia, aplastic anemia, and maybe due to viral infection due to parvovirus B19. Okay, next. Nakita nyo na rin to before, no? We can classify anemia based on the mechanism of blood loss and hemolysis. Unahin natin yung blood loss. We can further classify the conditions of blood loss according to timeline. Kapag more than or less than 3 months, no, pwede natin masabi na acute blood loss yan. And example natin dyan are your traumatic injuries. Ano ibig sabihin ng traumatic injuries? Yan yung mga physical injury. Okay? Example dyan, yung mga nasaksak, yung mga victims of motor vehicular crashes. Okay? Physical injury ang pinag-uusapan natin dito. Okay? Chronic blood loss naman takes for more than 6 months. No? Imagine niyo for more than 6 months naglalabas kayo ng blood or nag-lose kayo ng blood. Okay? So talagang magpo-form kayo ng anemia out of these conditions. Ano yung mga condition na pwede natin i-classify under chronic blood loss? Yung mga nagbi-bleed na colonic polyp from colon cancer, no? Back in AUBF, ano ang test natin para malaman if meron tayong or probably meron kayong bleeding colonic polyp? 'Di ba? Fecal occult blood test, no? FOBT. Ginagamit natin 'yan routinely in fecalysis. Next, we can classify hemolysis into 2, no? Pwede tayong classify according to the defects of the membrane. It's either intrinsic and extrinsic. Intrinsic, ibig sabihin nasa loob mismo ng RBC membrane ang problem. Extrinsic, outside RBC ang problem. I-discuss naman natin yan later on, no? Overview lang. Intrinsic defects may be caused by membrane defects, enzyme deficiencies such as your G6PD and pyruvate kinase, hemoglobinopathies, example natin dito, sickle cell anemia, and thalassemia. Extrinsic naman may be caused by macroangiopathic hemolytic anemia. Macro means big, angio means vessels. So, big vessels ang involved dito. In contrast with microangiopathic hemolytic anemia, maliliit na vessels ang involved dito. And then other infections such as your malaria. Back in yung parasitology, anong species ang involved with malaria? Your Plasmodium species. And then viruses such as your parvovirus B19 and Babesiosis. Ano ang causative agent of Babesiosis? Babesia microti. Okay, example ng ating mga conditions of blood loss. Diba? Dito, traumatic injury is classified as acute blood loss. Okay? Kapag ito, halimbawa dito, bleeding colonic polyp ito, no? It is a picture from colonoscopy. Okay? So, chronic blood loss ang meron naman dito. Okay, RBC indices naman tayo. The three most common RBC indices are MCV, MCH, and MCHC. Your MCV stands for mean corpuscular volume. MCH is mean corpuscular hemoglobin. MCHC, dagdagan lang natin, mean corpuscular hemoglobin concentration. So, anong clinical significance ng bawat isa? MCV, it is the measure of the RBC volume or the average size of the RBC. Isa rin ito sa mga index ng anisocytosis pero mas ginagamit si RDW over your MCV. MCH naman, the average hemoglobin per blood specimen, no? Hindi ito madalas ginagamit for classifying anemia, pero sinasama pa rin siya as part of your RBC indices. MCHC naman, it is an index of anisochromia. Ano ibig sabihin ng anisochromia? Yung color of the RBC under microscope, kung iba-iba sila. Because the color will indicate the relative hemoglobin content per cell. Okay? So, ano ulit ang MCV? It is used as an index for anisocytosis, MCHC for anisochromia. Okay. Other parameters for the laboratory diagnosis of anemia. First, RDW. Ito, ang pwede lang natin ma-derive na information dito is that if RBCs has a variable sizes, no? Or tinatawag natin anisocytosis. This is a perfect index of to know the variation of your RBC volume and size. Together with anong parameter ang pwede natin gamitin for anisocytosis. Aside from RDW, pwede natin gamitin ang MCV. Okay? Next naman, the reticulocyte studies. Okay? Ang reticulocyte counts kasi are considered as the perfect index of your erythropoiesis. Okay? Pag mababa ang reticulocyte count mo, may problem ka with RBC production that may be due to bone marrow failure or bababang erythropoietin levels. Kapag mataas naman ang reticulocyte count mo, anong pwede niyang sabihin? Pwede mayroong ongoing hemolysis or blood loss, kaya nagko-compensate si bone marrow to produce a lot of RBCs. Okay, to further study about or to further investigate for reticulocyte count, we compute also for the other formula such as your CRC, corrected reticulocyte count, RPI is your reticulocyte production index, ARC is your absolute reticulocyte count. So, babalikan natin itong mga formula na to. Okay? Sa CRC, ang kailangan mo dyan is the patient's hematocrit. Sa RPI, aside from the patient's hematocrit, kailangan mo din malaman yung maturation time. And I believe na-discuss na to during your reticulocyte count topic. And then ARC, hindi mo kailangan ng hematocrit. Ang kailangan mo lang is the RBC count data. So, aside from RBC count, hemoglobin, hematocrit, determination, we also investigate further by collecting bone marrow specimen. Okay? Ano ang pwede natin ma-derive na mga conditions by examining this specimen? So, pwede tayong mag-investigate further if we suspect the following disorders. If halimbawa, no, meron kayong na-appreciate na mga abnormal cells or cancer cells during bone marrow aspirate, okay? Pwede ka ang mga probable diagnosis mo dyan is number 1, sarcoidosis. Ano meron kay sarcoidosis? These are granulomatous condition in which you produce a lot of scar tissue, no? Napapalitan ngayon ng scar tissue yung mga bone cell producing um, tissue ng bone marrow. So therefore, bagsak ang cells mo. Leukemia, no? Yung mga cancer cells natin. So instead na normal yung counts ng WBC mo, dumadami, and minsan itong pagdami na to very defective naman yung mga WBCs. Okay? And instead sa mga other cases, dumadami din yung iyong mga RBCs and bumabagsak yung mga platelet counts. If ever na-observe mo sa bone marrow aspirate mo na wala kang masyadong nakitang cells, no, or tinatawag nating hypocellularity, you suspect of the following condition. Baka may autoimmune disease. Ano ibig sabihin ng autoimmune disease ulit? Ito yung mga condition na nagproduce ka ng antibodies against yourself, no? Yung mga organs mo. So baka may mga antibodies ka against the proteins found in bone marrow. The next, parvovirus B19 infection, no, can cause your pure red cell aplasia or bagsak lahat yung red blood cell lineage mo. Megaloblastic changes. Halimbawa, sa bone marrow aspirate mo, lahat malalaki yung mga cells, walang sumusunod dun sa tamang RBC maturation. You have to suspect the following. So, number 1, nutritional deficiencies from folate and vitamin B12. Ano nga ulit ang other name ng folate? Vitamin B9. Vitamin B12 is also known as your cobalamin. Okay? Next naman is Myelodysplastic Syndrome. Ano ibig sabihin ng Myelodysplastic Syndrome? From your general pathology lecture, ano ibig sabihin ng dysplasia? Dysplasia means meron disturbance of your RBs or of your blood cell differentiation or maturation. Okay? Mali yung pattern ng inyong stages. Okay? Minsan nagsustop, minsan bumabalik dun sa previous na immature cells. Next naman, may chromosomal abnormality. Halimbawa, yung Philadelphia chromosome, which is found in what type of leukemia? CML, or chronic myelogenous leukemia. So, for the rest of the topics, please open the PDF file about abnormal RBC morphologies. I-discuss natin sila isa-isa. Okay. So, let's proceed with the RBC and WBC anomalies appreciated under microscope. So, kung pwede, open nyo yung inyong file or print nyo yung file ng table of RBC and WBC anomalies. So, isa-isahin natin sila. Okay? So, sorry, medyo mahaba tong lecture. Nakakaya naman sa inyo kung medyo bitin itong lecture na to. Kumpletuhin na natin. Okay? So, unahin natin ang mga anomalies or abnormalities appreciated with regards to RBCs. Unahin natin si anisocytosis, which mainly means abnormal variation of the RBC size. Okay? Based dun sa RBC indices, pwede mo itong appreciate through the results of your RDW or red cell distribution width. Okay, ito makakapagsabi kung madaming or may increase or decrease anisocytosis present in the blood specimen. Recall lang natin, no, RDW is also used to differentiate IDA and thalassemia. Increase ang RDW sa IDA, normal ang RDW sa thalassemia. Next naman, mga macrocytes. Macrocytes has MCV level beyond 100 femtoliters. So, basically, ito yung mga enlarge yung RBC size. So, sino yung mga yan? No, makikita mo sila from the name itself. Megaloblastic anemia, okay, myelodysplastic, bone marrow failure, and reticulocytosis. Kung makikita natin, no, itong megaloblastic anemia, myelodysplastic anemia, bone marrow failure has a common denominator. Lahat nangyayari or lahat may problema sa bone marrow, which mainly affects the RBC maturation. And based dun sa rules natin, di ba, once RBC matures, dapat lumiliit yung size. Pero meron nga tayong derangement, no? So, it will retain the enlarged size, causing macrocytes. And then we have macroreticulocyte or also known as stress reticulocytes. Nangyayari ito in severe hemolysis. Kapag ang bone marrow ay in stress, no? Kailangan niya na mag-produce ng madaming RBC, yung reticulocyte hindi sumusunod sa rule. Okay, na-maintain niya yung enlarged size. So, ang tawag natin sa kanila is macroreticulocytes. Okay, dito tayo sa oval macrocyte, no? Oval macrocyte can only be seen in megaloblastic anemia. Aside from oval macrocyte, no, meron pa tayong ibang derangement. May makikita kang hypersegmented neutrophil and Howell-Jolly bodies. So, ang mnemonics natin before, no, HO-HO. H, hypersegmented neutrophil, O, oval macrocyte, HO for Howell-Jolly bodies. And all of this derangement is caused by a defect of your RBC maturation. Iba ang oval macrocyte from the simple ovalocyte. Okay? Simple ovalocyte can be caused by hereditary ovalocytosis, which is a defect in membrane proteins. Na i-discuss natin yan for later on. Okay, microcyte naman, mas mababa ang MCV, less than 80 femtoliter. Tandaan natin yung mnemonics na to, no? So, ang mnemonics natin para sa mga may microcytes is ATIS. A for anemia of chronic inflammation, T, thalassemia, I, IDA, and S, sideroblastic anemia. So, ito yung madalas na may microcytes. Okay, next term, poikilocytosis, variation of the shape. Okay, huwag kayong magpapalito with the size and shape, ha. Kapag size, anisocytosis, ang shape, poikilocytosis. Okay? And then next, spherocyte naman tayo. So, spherocyte, no? It is commonly seen in hereditary spherocytosis. Ano ang meron kay hereditary spherocytosis? Has a defect in the vertical anchorage proteins. Tatandaan nyo to back in the first part of the lecture. Okay? Ang problem dito is that it has a decreased surface ratio. Okay? So, mas madaming laman as compared dun sa size niya. Okay? Kaya ang MCHC levels nito is increased. Kaya ang makikita mo sa RBC Indices interpretation, it has normocytic and hyperchromic RBCs. Madalas din to makita in extravascular type of hemolysis, such as in immune hemolytic anemia and extensive burns together with schistocytes. So, halos laging partner yung dalawang yan. Okay? Spherocyte and schistocytes. Elliptocyte and ovalocyte naman tayo. Discuss natin yung mga hereditary condition causing this type of RBC abnormality. Elliptocyte, caused by your hereditary elliptocytosis, which is a defect in horizontal anchorage proteins. If ever may problem ka dito, it can cause loss of membrane's mechanical stability. Okay? So, hindi makakapag-bend yan ng mabuti across the capillaries. Ovalocytosis naman, or also known as Southeast Asian ovalocytosis or SAO. It has a defect of band 3 protein causing the rigidity of the membrane. Pero, no, hindi naman laging bad news dito. Kasi ovalocytosis can confer resistance to malaria. Tandaan natin, no, yung mga malaria Plasmodium species, gustong-gusto nila yung mga perfect RBC, walang defect. Okay? Kapag may ovalocytosis ka, ayaw ng mga malaria yan. No? So, wala kang, ayaw ng mga Plasmodium yan. So, therefore, may protection ka against malaria. Stomatocytes naman tayo. There are actually two types. No? Meron tayong overhydrated and dehydrated. Depende yan sa defect. Overhydrated stomatocytosis has increased intracellular sodium. Pag madaming sodium sa loob ng RBC, sumasabay yung tubig kasabay ng sodium. So, papasok lahat ng tubig sa loob din ng RBC causing overhydration. And this is also associated with Rh deficiency syndrome or tinatawag natin Rh null. Okay? Next naman, dehydrated stomatocytosis, decrease intracellular potassium. Okay, lumalabas lahat ng potassium out of the RBC. And this is the most common type and it has another name, no? Hereditary xerocytosis. Xero means dry, no? Dry for dehydrated. Okay? Sickle cell, or also known as dipranocyte, meniscocyte, or oat cells. Oat cells naman kapag less pointed yung ends. Okay? And recall natin yung sickle cell anemia. Ano ang merong genetic mutation dyan? Valine substitutes your glutamic acid at the 6 amino acid of beta-globin chain. Okay? Dapat valine ang answer for the, or yung mutation for the sickle cell anemia. HBC disease naman can cause a crystalloid form of hemoglobin. No? And in this kind of disease, ano ang genetic mutation? Lysine substitutes your glutamic acid at the 6 amino acid of the beta-globin chain. Halos parehas sila ni sickle cell. Ang pinagkaiba lang, ang genetic mutation for HBC is lysine. Target cell naman tayo. Target cell is also known as your leptocyte or Greek helmet cell or Mexican hat cell or bullseye cell. So, madaming ano yan ha, madaming other names yung mga yan. Okay? And ito naman, most commonly associated with liver disease, thalassemia, okay? Or other types of hemoglobinopathies. Sa IDA, walang masyadong mga codocyte. Mas ma-appreciate mo sila in thalassemia. So, one of the differences of IDA and thalassemia is the presence of your codocytes. Schistocyte naman tayo or schizocyte. Schizocyte or also known as helmet cells or keratocyte. Okay? Dito naman, madalas silang makita in intravascular hemolysis such as in microangiopathic hemolytic anemia and macroangiopathic hemolytic anemia. So, lagi silang partner with your spherocytes. Okay? And in other condition, no, it is mostly seen in intravascular type of hemolysis, DIC or disseminated intravascular coagulopathy. Okay? And yung mga example natin ng ganitong type of anemia, unahin natin sa macroangiopathic hemolytic anemia. Ito yung mga patient na may prosthetic valve sa puso. No? Sa microangiopathic hemolytic anemia, ang example natin dyan is TTP and HUS. What is TTP? Thrombotic thrombocytopenic purpura. HUS is hemolytic uremic syndrome. So let's proceed with acanthocyte, or also known as spur cell, or in other books, thorn cell. Okay? Kamukha niya si burr cell or echinocyte. Mamaya pakita natin kung anong difference nila. And acanthocyte are commonly seen in severe liver diseases, a beta lipoproteinemia, so paki-highlight yan, no? And pyruvate kinase deficiency. Pyruvate kinase is actually an enzyme which has an important role in Embden-Meyerhof pathway. So, babalikan natin to pagdating natin sa mga disorders of RBCs. Ito na, si burr cell or echinocyte or si urchin cell. So, tingnan natin kung anong difference ng dalawa. So, ito yung acanthocyte. No? Mas mahaba yung mga projections niya as compared to your burr cell. Okay? Dito naman, makikita sila in uremia as well as pyruvate kinase deficiency. And next, teardrop cell or dacrocyte. Itong mga type of abnormality is commonly seen in abnormalities in the bone marrow. So, tingnan natin yung kanilang mga associated disorders. Primary myelofibrosis is actually a proliferation of fibroblasts inside the bone marrow. Kaya tinawag na myelofibrosis. Myelodysplastic anemia is an anemia caused by a tumor found in bone marrow. And then megaloblastic anemia is a defect in RBC maturation. Siyempre, saan nagmamature yung RBC? Sa bone marrow as well. So, aside from the ho-ho mnemonics natin for megaloblastic anemia, dagdag natin dyan si teardrop cell. The next, bite cell naman tayo. Bite cell is actually an abnormality caused by the macrophages of your spleen. Kapag kinain niya yung Heinz bodies present in RBC, and yung Heinz bodies is formed in usually in oxidation caused by the deficiency of your glucose 6-phosphate dehydrogenase. Balikan natin mamaya si Heinz bodies. Dito naman tayo sa mga erythrocyte inclusions. Okay? Unahin natin, skip natin to. Unahin natin si basophilic stippling. Basophilic stippling is also known as punctate basophilia. Okay? And it is commonly seen in lead poisoning, thalassemia, and hemoglobinopathies or abnormalities in hemoglobin synthesis. Ano ba tong mga to? It is inclusion made up of precipitated RNA. So, ibig sabihin may something wrong dun sa formation of your hemoglobin dahil sira yung RNA. Remember, kapag may RNA habang may RNA yung stage ng RBC, doon may hemoglobin synthesis. Next is Howell-Jolly bodies. And Howell-Jolly bodies are fragments of DNA. So, wag tayong magpapalito. Basophilic stippling are RNA precipitation. Fragments of DNA naman si Howell-Jolly bodies. So, dito, most common, makikita dyan si megaloblastic anemia. Okay, yung ho-ho natin na mnemonics. And pakidagdag na rin, no, i-highlight din natin itong dalawa, hyposplenism and postsplenectomy. In these two conditions, no, 'di ba ang role ng spleen is to segregate or destroy the sequestered or old RBCs. Kung wala kang spleen, no, hindi na di-destroy easily yung mga dapat nang mamatay na RBC. So, akala ng katawan mo, okay pa yung levels of your RBC. So, nadi-disturb yung maturation ng RBC sa loob ng bone marrow, causing the fragmentation of the DNA. Next, your Heinz bodies or the denatured hemoglobin. Ito yung mga hemoglobin na na-expose sa mga free radicals or oxidants. No? Ano yung mga magpo-protect sa kanila dapat against these free radicals? It is supposedly the presence of your reduced glutathione produced by your pathway called hexose monophosphate pathway. And sa hexose monophosphate pathway, ang important enzyme doon is the glucose 6-phosphate dehydrogenase. As we discussed that topic previously, di ba? And kapag dumaan yan sa spleen, kakainin ng splenic macrophages yung Heinz bodies. Therefore, magkakreate ng bite mark sa RBC. Yun ang tinatawag ngayon natin na bite cells. And in other books, ang description ng Heinz bodies is that it appears like a pitted golf ball. So, yun yung parang may mga butas, no? May mga pitted holes dun sa RBCs. So, kumukha daw siya ng golf ball na normally nakikita natin. Okay, next, Papenheimer bodies. It is accumulation of iron inside the RBC. So, ano yung mga may accumulated iron na disorders? It is associated with sideroblastic anemia. Discuss naman natin to pagdating natin sa mga disorders. Okay? Mga disorder of hemoglobin synthesis. Okay? And thalassemia. So, in Papenheimer bodies, or also known as siderotic granules, ma-appreciate nyo sila by using this type of stain, your Prussian blue staining technique. And madalas, ginagamit to in bone marrow aspirate. Next, cabot ring naman tayo. Cabot ring appears to have a double ring or figure of 8 or infinity sign. So, ano ba yung infinity sign? Yan, yung parang nakaigang number 8. Okay? And cabot ring is actually remnant of mitotic spindles. No? Ibig sabihin, there's something wrong ulit with the RBC maturation. So, balik tayo. Anong mga associated disorders? Megaloblastic anemia and Myelodysplastic Syndrome. Yun yung mga disorders of RBC maturation. Okay, proceed tayo with HBH. There is a 3-alpha chain deletion. Ito yung genetic mutation present in HBH. And for now, no, i-take note natin na this is the fastest abnormal hemoglobin in alkaline electrophoresis. So we will discuss electrophoresis later on pagdating natin sa hemoglobin. And then kasama ng Heinz bodies, no, it also appears as golf ball appearance under microscope. So aside from blood testing and bone marrow aspirate examination, pwede ka rin gumamit ng other specimen to investigate for anemia. Halimbawa, urinalysis, you can investigate for intravascular hemolysis. Sa intravascular hemolysis, ma-appreciate mo yung hemoglobinuria or umiihi ka with the contents of hemoglobin, hematuria kapag sobrang severe na yung blood loss such as in malaria. Diba? Narinig na natin ng black water fever. Okay? And increased urobilinogen levels. In cases, most especially nga dun sa intravascular hemolysis. Fecalysis naman, pwedeng dalawa ang pwede mong ma-derive dito. In cases of chronic blood loss due to colon cancer, you can request for occult blood testing. So, makikita nyo, positive sila dyan. Sa mga bata naman na may symptoms of anemia, you can investigate further if merong parasitism caused by hookworm. So, ma-appreciate mo under microscope yung eggs or even the adult parasites. Sa CC, anong pwede nating ma-appreciate sa serum studies? You can investigate further for the presence of intravascular hemolysis through the decreased levels of haptoglobin. Recall lang natin, haptoglobin is the transport protein for the free hemoglobin. Okay? Increased LDH. Back in CC, napag-aralan nyo na ang LDH is part of RBC membrane. So, pag nagbe-burst ang RBC, lumalabas din ang LDH. So, increase sila. Increased conjugated bilirubin. Again, no? Kapag nagkakaroon ng free hemoglobin, nako-convert sila into unconjugated bilirubin. And another special test, no, Schilling's test. Para saan naman to? To differentiate pernicious anemia from vitamin B12 deficiency. Okay, as a rule, no, pernicious anemia always result to vitamin B12 deficiency. But not all vitamin B12 deficiency is related to pernicious anemia. So, malalaman nyo yan further, di-discuss natin yung differences ng dalawa. Okay, pagdating sa classification of anemia, we almost always based on the RBC morphology given from the data of your RBC indices. Okay? Halimbawa, sa normocytic, normochromic, ano ang expected RBC indices results natin? Normal MCV, normal MCHC. Microcytic hypochromic, low MCV, low MCHC. Macrocytic normochromic naman, high MCV, normal MCHC. At the same applies to this part of classification. Okay, bakit walang hyperchromic? Okay, the only hyperchromic anemia is the hereditary spherocytosis. Nadi-discuss naman natin later on. No? Wala nang ibang hyperchromic anemia aside from the spherocytosis condition. Anyway, let's discuss on or overview ng mga classification of anemia. Sa normocytic, normochromic, under dyan yung mga hemolytic anemias, no? Acute bleeding, acute blood loss, mga malignancies causing anemia, and splenomegaly. Microcytic hypochromic anemia, huwag kakalimutan yung ating mnemonics na ATIS, no? ATIS, ACI for A, anemia of chronic inflammation, thalassemia, iron deficiency anemia, and sideroblastic anemia, which may be caused by lead poisoning. Okay? And then sa macrocytic normochromic, we can further divide or classify this type of anemia into megaloblastic and non-megaloblastic anemia. Sa mga megaloblastic, dito persistent yung increased size of the RBC. These are maybe due to vitamin B12 deficiency na pwedeng associated with pernicious anemia, no? And folate deficiency or vitamin B9 deficiency. Sa microcytic normochromic non-megaloblastic anemia, walang persisting blast, no? Walang masyadong malalaking mga blast, pero ang eventual result, enlarge yung mga mature RBCs. So, kailan nangyayari ito? Sa mga liver diseases, alcoholism, and bone marrow failure. So, have a little break. Come back for the next part of this lecture.